Hi, I'm Linda, creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. Hi, this video is all about the difference between psoriatic arthritis and rheumatoid arthritis. Psoriatic arthritis and rheumatoid arthritis are excruciating and start as an immune system. The differences are the conditions, the causes of psoriatic arthritis. First of all, I shall look at psoriatic arthritis, where the condition could be genetic and is related to psoriasis. Also, it produces skin cells too quickly, and you end up with red bumps and silver scales on your skin, which can be painful, stiff, and swelling may occur on the joints. You may develop psoriatic arthritis at the age of 30 to 50, and both men and women can get this horrible condition. Now, rheumatoid arthritis. This develops on your joints. It happens because your immune system has gone wrong and attacks your healthy tissues. If this goes unnoticed, it can lead to your immune system attacking your kidney, liver, and even in severe cases, your heart. Rheumatoid arthritis symptoms. Rheumatoid arthritis attacks the main joints and both sides of the body equally. Hands. Your knuckles will begin to stiffen, and you will notice that it is hard to undo jars or even work on your computer keyboard. Feet. Your toes may swell and find it difficult in walking around. Wrists. The wrists will become stiff and painful with minimum movement. Elbows. You may be in pain with your elbows if you keep your arms bent for some time. Ankle. You will find it difficult in walking, but you cannot stop walking as this will prevent you from walking altogether. Neck. If you have it in your neck, it's so easy not to move it, but again you must keep moving, or it will get stiff. I try and do my exercises every day by looking up and down 5 times, then doing round motions with my head a couple of times. You can hear all the creaks and cracks, but you must keep all of your joints working. You will lose energy and appetite, and may get a fever. The joints may develop lumps called nodules. You could also have a dry mouth and eyes, also irritated eyes. Psoriatic arthritis symptoms could be itchy, painful, and red patches on the skin or even dead skin cells. The common joints are knees, elbows, and scalp. But it can be anywhere on your body, and in one or more joints at a time. Even your small joints, like your knuckles near your nails, will be swollen, wrist and even your ankles. Your fingers and toes may get swollen, called dactylitis. You may develop spondylitis, which causes low back pain. This can lead to hip pain and a stiff back. Even your ligaments and tendons could cause pain, where the joints are. This is called enthesitis. When you think you have arthritis, and have had joint pain for the past 2 or 3 weeks, you should see your doctor immediately, before the symptoms get worse. The conditions of both rheumatoid arthritis and psoriasis arthritis imitate other types of arthritic conditions. So, it is tough for your doctor to diagnose. Your doctor may take you to get further tests, to make sure which arthritis you have. The tests could be blood tests. This will show specific inflammatory markers in the blood, or an X-ray or an MRI scan. This shows how your joints are being affected over time. Both of these arthritic chronic conditions are unfortunately incurable. But there are many ways to keep the pain and discomfort under control. The treatment for rheumatoid arthritis will slow the inflammation and relieve the pains of your joints. There is therapy and medication that can help to slow down the symptoms. Your doctor may prescribe to you drugs called disease-modifying anti-rheumatic drugs, or DMARD for short, but drugs can have side effects, so you need to have the least dosages. The side effects could be feeling sick, sore mouth, and low appetite. You could even have either diarrhea or headaches, loss of hair, or it could affect your liver. If it affects your liver, you may have frequent blood tests. Less common is that it could affect your lungs. This means regular chest X-ray and possible breathing tests. The treatment for psoriatic arthritis is similar to rheumatoid arthritis, where it controls the inflammation and prevents damage to your joints and disability. Your doctor will prescribe you DMARD drugs. You may need to try different ones to find the correct ones for you. There is also an anti-inflammatory gel called ibuprofen. The one I rub on my hips and back is called Fenbid, which I rub on 3 times a day, and seems to work. But with every drug, there are side effects. They could be stomach irritation, heart problems, and liver and kidney damage. There are other drugs in the DMARD group. One is methotrexate. These are Trexall or Otrexup, which could damage your bone marrow suppression, inflammation of the lungs or fibrosis, scarring. Another one is called conventional DMARD, but an excessive amount of this drug is dangerous as it may bring blood clots to the lungs, could also have hazardous heart-related signs or even could cause cancer. The following remedies can be used for either psoriasis arthritis and rheumatoid arthritis, or other types of arthritis and conditions. The first is to maintain your weight. If you are overweight, you are putting more weight and strain on your joints, increasing their pressure. You also need to lose weight, as research has found that medication is less effective if you are overweight. Second is exercise. If you are like me with pain and inflammation nearly all the time, you don't want to exercise. But it would be best if you exercised, as this can help your joints to keep flexible and your muscles strong. You only need to do gentle exercises like do some cycling, swimming, walking, or even yoga and Tai Chi. Don't smoke. Another one is that you should not smoke. Smoking and psoriasis result from a very high risk of developing severe symptoms. Number 4, alcohol. If you drink alcohol, you are at an increase in side effects from some of your medication. For example, methotrexate. Serious side effects of this drug could be liver problems, difficulty in breathing are only 2. So, it would be best if you minimized your alcohol intake. When you are already fighting through pain day in day out, it could leave you very exhausted and fatigued with your medication. It would help if you paced yourself throughout the day, and rested before you got too tired. Divide the housework and exercises into short sections, relax through the day. If you live alone and need help, you should find a support group near you. Or get help from your friends and family. By going to help support groups, you will get help and information that you never knew. Also, your therapist can help you cope with strategies that reduce your stress. After your doctor has discussed with you your signs and symptoms, they may refer you to the rheumatologist who specializes in arthritis and similar conditions. You should bring a friend or family member with you when you get your appointment. They will help you with all the information that they give you. It would be best if you made a list of what you are worried about. For example, when did your symptoms start, and what are they? Also, take with you your medical and family history. You also should list your medication and any supplements with the dosages. Write down any questions that you have. The basic questions are: what is the cause of your symptoms? What sort of tests will they need to do? What treatment is needed, and what are available? Are there any leaflets that you can take away and read? Is there a website that they can recommend? The specialist may ask you: which joints are affected? What makes the joints worse or better? Have you tried any treatments? If so, have they helped? Conclusion is: when you suffer from any type of arthritis or the same symptoms, you should take each day as it comes. Do some exercise to keep your joints supple and your muscles strong for as long as possible. And if you are overweight, it would be best if you go on an inflammatory diet. There are 2 types of diets that can help you. They are the DASH diet and the Mediterranean diet. Both of these diets help with your inflammation and pains. Also lose weight. Try and stop smoking and drink less alcohol. If you do these things, you are helping yourself to reduce the pain and inflammation. Also, get your lifestyle back. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.